Human exposure to hot water can be a significant risk. At 140 degrees temperature, it only takes 3 seconds to develop a significant burn. As children are younger, as infants, submersion or a bathtub is one of the biggest risks. That water needs to be checked and made sure that it's not too hot for that child, noting that their skin is more sensitive than an adult. If a baby's skin is red, then usually that water is too hot. The adult should check that water, particularly on the back of the wrist, and that is probably one of the thin areas of our skin that gives us an appropriate gauge of what that temperature actually is. As we get older, one of the biggest risk factors is a scald injury from ramen noodles or from other hot material that comes particularly from a microwave. As that child pulls that material out of the microwave, they look at it and it spills on their skin, and that is the #1 scald injury with pediatric patients. With any scald injury, what can help alleviate some of the pain is a cool wash rag that is clean. However, if we have significant blistering of that skin, they do need to be seen by a medical professional, and typically those will also be transferred to a burn center. Here at EIRMC, we have facilities and ability to help that child through that difficult burn and that pain that can be associated with that.